Hi, and welcome to the VieSID Press-release. With this short presentation, we want to report on the dental literature published in September 2021. We have chosen articles from a selected list of journals that we think might be of interest to the VieSID community. So, let's start. We begin with articles in the Journal of Oral Rehabilitation. Note that this journal publishes the review history alongside the articles. The work by Donnarumma and colleagues focuses on waking state oral behaviors in TMD subgroups. They selected over 300 TMD patients and classified them into three groups, namely dysfunctional, painful, and combined TMD. They considered various oral behaviors, including functional, such as talking and chewing, and non-functional, such as bruxing, clenching, holding object between the teeth. And they in fact found an association between the non-functional oral behavior and temporomandibular disorders. In this paper, Guardia Nardini and colleagues carried out a macroscopic evaluation of 14 temporomandibular discs extracted during surgeries from TMD patients. They describe alterations such as wear, perforations, and irregular edges. Also, they found histological alterations, including sclerosis and loss of elasticity and synovial inflammation and calcifications. The author seems to suggest that in case of this degeneration, this removal represents a chief therapeutic approach, but I leave to the readers the evaluation of this very point. This next paper is by Grini and Manfredini. They discussed an important topic, namely chronicization of pain in TMD patients. They describe possible predisposing factors to TMD, including muscles, temporomandibular joint, and disc. And highlighted the fact that TMD patients mostly suffer from psychological conditions and poor sleep of quality. Eventually, they attributed TMD chronicization to two main factors: the psychological condition of the patients and iatrogenic effects deriving from excessive, inadequate, or wrongly performed neurological treatments. As they often do, these authors have dealt here with a crucial and complex topic with important implications for dental practice. To our opinion, however, they offered only a partial and at times inaccurate view on this topic. For example, the definition of chronic pain used in this work is outdated and does not take into consideration the discoveries made over the last 20 years on the brain mechanism characteristics of chronic pain. Similarly, it is not considered that the psychological distress and anxiety of chronic pain patients might be a consequence rather than the cause of pain. From a clear and comprehensive discussion of these topics, I suggest reading the article by Barroso et al., published in Transactional Research 2021 and entitled Brain Mechanisms of Chronic Pain. So furthermore, Grini and Manfredini substantiated their thesis that occlusal treatments are harmful to patients and lead to pain chronicization by an ad hoc selection of malpracticed clinical interventions. So instead, there is no mention of the fact that competent dental specialists might be able to effectively treat TMD patients. This next article is an opinion piece on centric relation by Sonnenberg, Türp, and Grini. Their thoughts can be summarized as such. The term centric relation is inappropriate on semantic, conceptual, and practical grounds. and as such, its use generates confusion. It misleadingly conveys the idea that the condyle must be centered within the glenoid fossa in a given standardized position. Instead, they noticed TMJ structures and relative positions are highly variable in humans, and every individual is unique in these terms. Moreover, the stomatognatic system is highly adaptable and the skeletal structures can remodel. Thus, as they define it, the average orthodontic patient does not need an instrument-based reposition of the jaw, while a manual, approximate but reasonable reposition can be done, since it will be tolerated by most patients. Thus, they concluded that the treatment should be driven by occlusion. To our opinion, the authors correctly raised concerns about the term-centric relation and the confusion that surrounds it. Also, it is incontrovertible that humans are morphologically heterogeneous and that each individual is characterized by their own set of features. However, we find that these authors did not clarify important points necessary to understand their take-home messages, such as their definition of average patient, or the interpretation of centric relation for dysfunctional patients, so which, according to Sonnenberg and colleagues, need a new position of the jaw. Moreover, although it is true that there is a certain degree of adaptability of anatomical structures, it is also known that this decreases with age or in injured or inflamed tissues. Furthermore, it is difficult to assess the effect that some treatments might have in the long term. So we wonder whether an approach entailing an individualized but still rigorous assessment of the individual stomatognatic system could be more cautious and therefore safe for the patients. This editorial of the Quintessence International was written by Green and Orbach. Here they reported on a consensus document of the National Academies of Sciences, Engineering and Medicine that was published in 2020 with the title Temporomandibular Disorders, Priority for Research and Care. This consensus report resulted in 11 recommendations that I briefly report. The first 4 recommendations are about setting priorities for public health and clinical research on TMD. Recommendations 5 and 6 focus on how to improve risk assessment, diagnostic, and dissemination of clinical guidelines. Recommendation 7 is about improving the financial conditions for patients needing clinical intervention. Recommendations 8 to 10 discuss the foundation of centers of excellence for TMDs and orofacial pain and the establishment of professional schools for specialized education on this topic. The last recommendation is to educate and raise awareness among TMD patients. So clearly, the consensus report by the National Academies of Sciences, Engineering and Medicine deserves our attention. As first thing, I was curious to see how it regards occlusion in relation to TMD. They acknowledged the complexity and multi-causality of TMD and noted that there is no unanimous nor definite evidence with regard to the role of occlusion in the etiology of TMD. So although we think that it is difficult to disagree with these facts, we acknowledge that this consensus report is based on the biopsychosocial model. It is, however, reassuring to see that they declare to remain open to the advancements that further research will provide on TMD. I want to bring to your attention also that the American Academy of Restorative Dentistry published their annual review of selected scientific literature in the Journal of Prosthetic Dentistry. This document by Kanya and colleagues reports on various topics including prosthodontics, periodontics, implant dentistry, and dental materials. You will find also a detailed section on occlusion and TMD and a summary of the literature on sleep disorders. In the oral medicine and surgery section, this review gives ample room to SARS-CoV-2 infection and oral lesions associated to COVID-19, and finally reports on articles focusing on dental caries. So with the presentation of this dense work, I conclude this press release. I invite you to contact us in case you want to know more about our activities, and otherwise be ready for an next press release. Best wishes to all.